Hi, I'm Robert Meehan. At Health Republic Insurance of New Jersey, we believe everyone needs to be informed about the importance of healthcare coverage and the opportunities that are available. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus New Jersey has been provided by Health Republic Insurance of New Jersey, the New Jersey Education Association, Wells Fargo, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation, the Healthcare Foundation of New Jersey, founded by the Jewish community, MD Advantage Insurance Company of New Jersey, and by NJ Best, New Jersey's 529 College Savings Plan. Turn a dream into a degree. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com. And by the New Jersey Business and Industry Association.
Steve Adubato here in Philadelphia. This is the Healthcare Collaboration Summit put together by the folks at Virtua and CHOP Children's Hospital of Philadelphia. They're setting up the stage for another panel of CEOs coming together, talking about collaborations in the area of healthcare. Folks from all over the Eastern Seaboard, frankly, who've come together. Hospital CEOs, government officials, former members of Congress, policymakers, everyone coming together, talking about collaborating, talking about lowering the cost of healthcare, talking about helping consumers get better healthcare. Ultimately, that's what this is about, collaboration, partnership. And we've talked to a whole range of folks. So for the next half hour, check out Collaborating in the City of Brotherly Love. A couple years ago here in Philadelphia, we talked to our good friend Al Campanella, who is Executive Vice President of Strategic Growth and Analytics at Virtua. That conference was important. This one is as well, dealing with collaborations. You're on a panel called Digital Medicine, the Next Frontier. What does that have to do with collaborating?
Well, we see lots of technology in our society. People are wearing Fitbits, there's social media, but how does that all apply to healthcare? Well, in healthcare, you have to have lots of folks working together. Patients themselves, physicians, nurses, and the technology vendors, all working together to make sure that this technology is truly useful, designed to be used easily, and that the data that's generated can be evaluated and used by those healthcare providers and consumers in a meaningful way.
So let's break this down and give us an example. The Fitbit, I'm thinking to myself, what does that really have to do with collaboration? So if I have the Fitbit, got it on, I'm monitoring myself. Why do I need to be collaborating? Why do clinical professionals need to be collaborating about that?
Well, exercise is an important part of health. Those people who exercise usually have, trim waists. They have good cholesterol levels, and especially if you have a chronic disease such as diabetes, you want to keep exercise up. So it's important that devices like Fitbit will help you monitor how many steps you're walking, your exercise, and so on. Now, how does that matter to the physician? Well, the physician cannot possibly know every single day's worth of data that you're generating with Fitbit, but he or she will at least want to know that you are exercising, that you are monitoring your fitness levels, and that it is contributing to your long-term health plan.
But isn't it complicated and difficult to share this information? Because there's so much information and the potential for, dare I call it, information overload clearly exists?
Yes, absolutely. Information overload can be a problem. I call it a data tsunami.
A data tsunami.
A data tsunami in some cases. What we've done really is roll out remote biomedical devices to people's homes. And these are FDA-approved devices.
What do they look like?
They're usually small monitors. You can attach them to your finger or to your wrist, or in some cases to your chest, or in some cases they're weight scales for taking weight. And they transmit data back to a central repository, and then nurses or other professionals can look at the patterns that are seen in those data. And in some cases, if the data triggers a problem, then we'll follow up immediately with the patient.
So let me get this straight. So someone is monitoring that information all the time, and does it trigger when there's an issue?
Yes. So every day, for example, a person with congestive heart failure is asked to take their weight. And if their weight were, for example, to increase by 2, 3, or 4 pounds, that might be a sign that there's an issue with the disease. And so we would see that weight come over through the secure internet connection to our monitoring system, and then it would trigger an alarm if it were too high, and then in turn, the care coordinator would reach out to the patient.
But Al, isn't it also fair to say that patients need to be involved? And when you talk about the fact that you're involved in analytics and strategic business growth, that's on the corporate side, that's on the healthcare side, but the fact is we as consumers have a role to play in all this.
Consumers have a great role to play. Behavior change is hard, and sometimes technology can help incent people. So you see, for example, now mobile apps where there are rewards given, incentives, just the mere fact of tracking different metrics each day get people more involved.
So the idea that I am tracking myself and know what I'm looking for and taking some degree of ownership of my own health matters.
Absolutely.
Finally, a summit like this here in Philadelphia is so important because?
This summit's very important because it brings together so many different stakeholders. We have today represented at least 5 different health systems are here today. We have 3 commissioners of health here from each of the surrounding states. We have numerous technology vendors, other people from the government sector and the private industry sector. It's phenomenal to see how much collaboration there is and how much there is possible and needs to be in the future.
And sharing best practices.
Absolutely.
Thanks, Al.
You're welcome, Steve. Thank you.
We're here with Chris Kalkof, who is in fact Director Strategic Solutions at Navigant Consulting. Tell folks what Navigant's all about.
Navigant is very much in the healthcare practice about helping organizations through the change process, through the transformation process in terms of evolving their organization from today's type of business operating model to what they need to have to be successful tomorrow.
Let's talk about this, Chris. You know, one of the things that you told our producers you wanted to talk about was transforming the payment system in healthcare. What's wrong with the current payment system?
The current payment system, the fee-for-service model, really rewards individuals who provide the care no matter what the outcome is. It's a volume-driven system, and so it's not really designed necessarily around the needs of the patient, the needs of the physician, as opposed to more of a reimbursement model. So payment transformation really is about looking at how do we create value at a patient level, how do we create value at a stakeholder level, and hold providers more accountable for the care they deliver, the resources they use, and the outcomes they deliver.
So let's talk about this a little bit. This summit's about collaborations, partnerships. So if we're talking, Chris, about how to collaborate, how to partner, what is the connection between collaborating and bringing down the cost of healthcare?
It's a 2-part equation. So in today's world, there's the provider part of the equation and there's the payer part of the equation. To really be able to change the care model, which is where the value creation occurs, there needs to be a lot of data. And so what providers have today in the traditional models, they only have data on patients that they treat. They don't really know what happens to that patient across an episode of care, particularly when it goes outside their 4 walls. So when they collaborate with a payer, they can work together to use the data to figure out what's the best way to deliver care for this patient across this type of episode of care for the optimal outcome. And that's just not really available in the traditional fee-for-service model.
Yeah, this whole fee-for-service model has been talked about a lot. The other thing you hear a lot about, and you'll hear a lot about today in this summit about collaborating, is population health. One of the things that we've learned about the healthcare field is there's a lot of jargon. That's one of the terms out there today. If you were to break down, Chris, the term population health, so that the average person watching on public television, FiOS, and everywhere checking us out right now, population health means what?
It's really about the overall type of healthcare delivery needs that are defined, usually in healthcare terms, an attributed population has. So whether it's a Medicare population or a Medicaid population or the traditional commercial population, those individuals break down into different age and gender categories, and depending on their health disease status, they have different access needs. So it's really about having a comprehensive, holistic type of view on the patient care needs, everything from the preventative side through the acute side, the post-acute, and even into end of life.
Are we doing that now?
We're doing it now, but it tends to be very fragmented because there's a disconnect on data flow, there's a disconnect on information, there's oftentimes a lot of
Give us, for instance, because there's a disconnect on data flow. It's hard to follow that lingo.
I'm a patient, I'm admitted into a hospital, ED, for a particular condition related to my chronic disease. I am treated, I'm stabilized, I'm released. That information doesn't necessarily flow back to the physician, their primary care physician, their specialist physician. They may be unaware of tests that were performed, and additional diagnostic tests may be ordered that are duplicative and not necessarily in the benefit of the patient. And if they don't have the information they need to really understand the condition of the patient, and then it becomes very difficult for them to decide what's the most appropriate treatment as a next step.
Isn't this difficult, though, Chris, when you talk about changing the payment model, right, from fee to service to a very different model? I mean, what does that actually mean to the patient, and how does the patient deal with that?
At a patient level, if it's done right, it's really seamless, but the mechanisms behind it are how the patient is navigated. Instead of Dr. Jones sending to Dr. Smith, because they've always done that, Dr. Jones says, relative to this patient, i.e. the population health, I should not be sending them to Dr. Smith just because I've been referring to him for 20 years. I need to send it to Dr. Abuelo, and because she specializes in these chronic kinds of disease and these complications, and she's better able to return that patient back to daily activities than having them migrate through the system one stop after another, trying to find out who can really best work with my medical condition.
What caused us to do all this? I mean, like, what's the problem that caused us to say, hey, the status quo is just not working?
The biggest driving problem has been the cost of healthcare as a percentage of the GNP, as a
Gross national product.
Gross national product, is a per member per month kind of situation. That is the aggregate cost of care we see translated into premiums, and also the annual trend, which far exceeds the CPI, or
Consumer Price Index.
Consumer Price Index.
There's a lot of jargon in healthcare, isn't there?
There is a ton of jargon. Some of the names are very long.
Yes. But we had to get that cost down.
Yes, we need to get the cost down, at least moderate the cost. Most of today's type of value-based payment models are designed to ideally reduce that per member per month spend to some degree, but more so geared towards changing the growth trend. Instead of a 7 or 8% trend, we may change the trajectory into a 1 or 2% trend.
It still will go up, but not as quickly?
Correct, if all works well. It's like the perfect golf swing. Not my golf swing. But
Not mine.
you have to get all 20 things right at the same time.
Thank you, Chris.
Thank you very much, Steve.
Hi, Steve Adubato. We are here in Philadelphia, the city of brotherly love. This is the Virtua Healthcare Collaboration Summit. We're here with Stan Collender, contributor Forbes, with Forbes, and also Executive Vice President, Corvus MSL Group. Now, you're part of a panel discussion, fireside chat on politics, healthcare, and more. What is the political climate as it relates to healthcare moving into 2016?
Well, the budget agreement that they just got through Congress actually put all the burden on healthcare. I mean, it was healthcare cuts that financed a lot of what else was going to happen. So you can see it's lining up. That is, healthcare is lining up to be the big pay for in the future. I mean, there are going to be pushes to reduce Medicare and Medicaid spending, pushes to reduce some of the things on the Affordable Care Act. Some of the questions will be on whether the National Cancer Institute or the other parts of NIH continue to make as many grants. It's such a big part of the federal budget now that it's got to be one of the things that they look at all the time.
Break that down for the average person, Stan, who doesn't really follow the federal budget the way you do. And they say, okay, what does that mean to me? So there are cuts on some of the entitlements. There are cuts at NIH, the National Institutes of Health. So what does that mean to me? Does it affect the average person's life?
Well, it actually affects everybody in one way or another. Either you're paying into Medicare, for example, and may have to pay more for it, or your parents are getting it, or you're getting it, or you want your parents to continue to get it, or do you want to make sure it's going to be around for your kids? Medicare, Medicaid are now an increasingly important program as people age, and it's used for nursing homes and assisted living. And of course, all the research that's done in all the major diseases like Alzheimer's, like cancer. It affects everybody in every way. In fact, there probably isn't a healthcare dollar that doesn't touch every American in some way, somehow.
Let's talk about the Affordable Care Act. To what extent, and we're taping this program in the fall of 2015, 2016 is going to be a fascinating year in this region, in the nation. On the political side, to what extent do you believe it matters who becomes president in our country as it relates to the Affordable Care Act and its implementation?
It's actually going to be very difficult given 10, 12, 14 million people may be benefiting from the Affordable Care Act by the time the next president takes office. It's going to be very, very difficult to just do away with it, to simply repeal it.
Hold on one second, Stan. I hear a lot of people saying, let's do away with quote-unquote Obamacare. Let's do away with the Affordable Care Act. Am I missing something?
Yeah, what you're missing is that they're playing to a very particular voter base that doesn't like Obama and doesn't like Obamacare. But for the 10 to 12 to 14 million people who are on it, it's becoming increasingly important. Now, look, a lot of the same types of people said the same thing about Medicare and Medicaid, actually, and Social Security back in the 30s. And let's get rid of it, let's repeal it. And the longer it stays in place, the harder it's going to be.
Because?
Simply because too many people are enjoying the benefits of it, and it's doing away with it would be too disruptive for the healthcare system. I mean, that's what you've got to remember is that you're actually, it's not just a mechanical change, fill out a different form. You're actually having a material and substantive effect on individual people's lives, how they get their health care, which as America ages becomes increasingly important, and it becomes increasingly important to the voters. So a Republican president, a Republican Congress might want to make changes in Obamacare. They might call it a repeal, but there's no way it's going to be repealed completely or even substantially.
But and again, at the same time, let's break this down a little bit, because Stan writes about this. He understands it in a way that the average person doesn't. Let's talk about the possibilities of revisions, if you will, in the Affordable Care Act. Do you see it, Stan?
Actually, they just included one small revision in the budget agreement that was just done.
The federal budget agreement.
Federal budget agreement that was just done. And no one's going to even realize that it was changed because it hadn't been implemented yet. Like any major law, there will be some tweaks along the way. There'll be some changes. The industry will evolve. And the law won't do exactly what you would expect.
What is the revision, and does it matter to the average person?
Well, it depends. I mean, if it's a politically motivated revision, it'll be much more substantial than otherwise. But my guess is that they'll be doing tweaks, and most people won't notice the difference. It'll be mostly changes in the way healthcare is reimbursed rather than the way healthcare is delivered.
This is what I'm curious about. If healthcare is in fact as complex as it appears, understanding it, reforming it, changing the payment system from fee to service to a very different model, as we've been talking about here at the summit, the collaboration summit here in Philadelphia at the Marriott where we are. Why is it that when it's talked about politically, it's talked about in such simplistic terms? Why is that?
Well, look, I don't mean to demean the average voter, but the average voter doesn't really read the news, or read the newspapers, read the news, and isn't up on the details. I mean, that's what they have representatives for. But they tend to be responding emotionally rather than factually. I mean, that's the true of most political issues. But healthcare, in this case, is tied up to Obamacare, tied up to the President Obama, tied into Democrats. So it becomes this emotional political issue. And it's the kind of thing where facts don't matter. People they're responding viscerally.
Facts don't matter?
Facts don't matter, and that's the sad truth about American politics today. In most issues, facts don't matter. In fact, if you watched any of the most recent Republican debate, a lot of what they were talking about when it had to come to do with taxes or deficits or health care, there were very little factual statements. They were all emotional statements.
What about on the Democratic side?
Well, the Democratic side is true to the same extent, but you don't have 16 people on stage all trying to one-up each other.
What happens in the general? What do you think? Will there be a more substantive discussion about health care, in your opinion?
There seldom is. Usually those discussions.
Why not? I mean, with so much at stake.
Because, again, the average person is responding emotionally rather than factually. They've already made up their mind, and the facts don't matter. That's what we've seen on not just healthcare, but every issue.
But healthcare matters.
Healthcare matters, but look, let me give you an interesting thing. The Tea Party is adamantly against, Tea Party members, the individual voters, adamantly against federal government spending. But most of them are on Medicare, and they think that they say repeatedly, I want to keep the government out of my Medicare. Medicare is a government program. It has been since the 60s.
Is that a disconnect?
Oh, it's a complete disconnect. And they don't even realize that they're getting the same kind of entitlement that they complain about other people getting. Just don't touch theirs. Touch someone else's. By the way, it's true of taxes, too. Increase someone else's taxes, don't increase mine.
So, final question, Stan. As we move into 2016, the face of healthcare, going to continue to dramatically change, or is the Affordable Care Act what we're going to be living with for a while?
Well, it depends. If you're working for a big company, you'll probably continue to get the kind of health care coverage you've always had before, company provided. I don't see any major change happening at that anytime soon. If you're partially or completely unemployed or retired, Obamacare may be the best alternative for you, and maybe the only alternative for you. And then you add on Medicare and Medicaid on top of that. The system's not going to change radically beyond that.
Thanks, Tim.
My pleasure.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
Steve Adubato in Philadelphia. This is a really important summit. Summit put together by the folks at Virtua and CHOP, the Children's Hospital of Philadelphia, all about collaborations in the area of healthcare. And we are pleased to be joined once again. We talked to her last time, Stephanie Fendrick, who is Senior Vice President of Strategic Partnerships and Service Line Strategy at Virtua. Stephanie, collaborations, let's give a sense of what we mean by that. First of all, the Virtua and CHOP collaboration is a big deal. But what kind of collaborations are we really talking about, and what does it mean to consumers of healthcare?
Sure. So when we talk about partnerships, Virtua wants to be known as the place for anyone in our community to come to us for their healthcare needs. That doesn't mean that every single one of their needs that Virtua can meet, and that's where partnerships and collaborations come in. So we first look at partnerships in terms of what services can we bring into our community that maybe we have a gap in today so that it's convenient, accessible for members in our community to get that care. And then there's certain types of more tertiary, quaternary type care.
What does that mean, tertiary, quaternary? I can't even say quaternary. So go ahead, describe that.
Sure. It's more advanced care. You usually need multiple specialists. Fortunately, there's a smaller volume of those types of cases. So in order to gain a real competency or skill set and being able to take care of those patients, we look to our partners to work together on things like quality, ease of access, working to get the patients to get to our partners, for instance, Penn Medicine for cancer and neurosciences, and certainly the Children's Hospital of Philadelphia for pediatrics. Help that family and patient for those advanced needs, and then have that patient come back to the community so that we can continue to follow them for their routine needs.
So is it basically saying that a hospital should not try to say it can do everything for everyone because it actually can't be, it isn't the best option to do everything for everyone?
Well, I think you have to know what your strengths are and work off your strengths. And I think it's important to know where you might have some gaps, and can you fill those gaps within your community, or is it...
Which is a strength to be able to know what you're really good at.
Absolutely. If it's something that just the volume's too low or the investment to have that kind of expertise is too high, then it's important to consider partnerships as an option to meet those needs for the community.
So it's interesting, strategic partnerships. You have them with CHOP, because we were talking with the CEO of CHOP, and she was actually talking about that. She was saying, yes, we do have this worldwide brand, and they're the oldest children's hospital in the country. I didn't realize that. She said, but certain procedures, certain medical procedures, they shouldn't be done here, and that's why they collaborate and send folks to other hospitals like yours.
Absolutely. And that's really the beauty of our relationship with the Children's Hospital of Philadelphia is we've really been able to talk about the right level of care at the right place, at the right time, at the right cost. And there's a place for Virtua in that description, and there's a place for CHOP in that description as well.
Okay, so let me play devil's advocate. Competition in the marketplace, right? So everyone is competing to stay in business. Everyone's competing to maximize, I don't want to say it's profit because they're nonprofits, okay? But at the same time, to do well. How the heck do you collaborate in a region and in an area when you're competing? Isn't that hard to do?
Well, I think, again, it's going back to what each organization's strengths are. While there might be some overlap, for the most part, if you hear Madeline talk about the Children's Hospital of Philadelphia, the CEO, I would say, 95% of their beds are more ICU level beds. That's not the space that Virtua is in, and that's where you can start to really play off each other's strengths. The same with Penn. We have a partnership with Penn Medicine. We announced it about 2 weeks ago, and the types of patients that they take care of are much sicker patients, more complicated patients. Again, that's not the space where Virtua is going to be. Our opportunity with Penn is they've invested a lot in cancer research, in research for neurosciences. How do we benefit from those investments that they've made and bring that into our community for our patients in South Jersey?
It's interesting. You have to establish those relationships. You have to build those partnerships, because you just all of a sudden can't send someone to Penn or send someone to CHOP. You're working on those relationships all the time, aren't you?
It's like any other relationship. It's one that, you find where you are aligned. You start to work towards that alignment. You find areas where there might be some disagreement, and you work through them. You nurture the relationship. You build trust. And over the course of time, you get to know each other's cultures more, and you can really anticipate each other's reactions and work together more effectively.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Health Republic Insurance of New Jersey, the New Jersey Education Association, Wells Fargo, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, MD Advantage Insurance Company of New Jersey, and by NJ Best. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
I will. It's the oath of those strong in character. A call to build our own dreams, not someone else's. Doing whatever it takes to create a better way. This is Health Republic, a not-for-profit co-op health plan created to give us control of our own health care. So we all have the support we need when it's time to say, I will. Health Republic. Live independently healthy.